looking at the future of asthma, where are treatments headed?
Yeah. Treatments for asthma are headed in the right direction because we understand now the inflammatory molecules that are responsible for these exacerbations. We understand why certain cells get called to the party.
Yeah.
We understand what activates Savannah and what gets her into the room to bring that speaker. We understand that more and more and more.
Right.
What you're going to see with future therapies is a couple of things. One, for some reason in America, everybody wants the best one thing, right? If you look at cancer therapy, they're using 2, 3, 4 different molecules to manage cancer.
Right.
We're going to be doing the same thing with asthma therapies. They might get 2 or 3 different injections in addition to the inhalers. That's kind of one thing. We're also going to use more cellular communication inhibitors, more biologics. So we're going to hit different types of inflammatory molecules, right? It might not just be targeting interleukin 4 or 5 or 13. We're going to be targeting, we target a molecule called TSLP. We're going to target a molecule called periostin. We're going to target different types of molecules, right? That's another thing. And then the other thing, what you're going to see is the GINA strategy was written years ago before we truly understood the immunology of asthma. So the GINA strategy, as medications become more accepted, as medications become more accessible,
Right.
and there's an argument on if they're accessible or not, you're probably going to see a shift in how we manage patients. Again, the GINA strategy is step 1, 2, 3, 4, 5, 6, right? And you start with inhalers and you work your way up to the biologics. What we know in the medical literature is the earlier you give a biologic, the better the outcome is, right? And so you'll probably start seeing a shift on giving those biologics earlier, which is probably going to lead to better outcomes in the future when you start and think about it.
Right.
And so my wish is that people come together and start to discuss, all right, guys, like we know this now.
Yeah.
Let's see if we need to, how do we
Yeah.
push it forward? The issue is going to be, though, is cost, right? Because some of these medications are ridiculously
It's always
expensive.
cost.
Always cost. They're ridiculously expensive. When you think about a global initiative, we're talking the entire world.
Yes.
So we just got to make sure that these medications are available. So that's why it's written the way it is.